You can do this. You should be doing this.
Enough said.
Enough said. Next slide. You guys take anything away from this at all tonight, that's what you should take away. When we look at snoring, just snoring, in other words, in your practice next week, Guy, if every single patient that walked in the door that was 40 years old or older, you said, do you snore? Have you ever been told you snore? How many people would say yes?
In my practice, over half. Well, over half do. Now, you also need to ask their partner. Asking do you snore is probably not as valuable as saying do you or your partner snore. 50% of those are near it's going to come up in my practice if they're honest. It may be a little less than that, but because a lot of people don't tell you, they're embarrassed by it. They think it's something to be ashamed of, or they may think it's funny too at the same time. They may kid about it.
But it's not funny. When you look at these two studies that were done, they show that the inflammatory response of the tissue being just pounded against something else, which is what makes that sound in snoring, can indeed lead to sleep apnea. And we well know already, and we're going to learn even more about tonight, the other things that cause this problem. So it's not a laughing matter. And when we start to see this and see how prevalent it is and the problems that it causes, we can start to get excited about what we can do about it.
The reason it's not a laughing matter is snoring is the beginning of sleep disordered breathing. If you think of the airway as a tube, put a vacuum or a blower on the end of the tube and think of it as a pipe, and you start constricting that pipe, well, what does it do? It's a whistle if you make it small enough. And you add a little plastic bag inside of it, it starts flapping around. That's what snoring is. Snoring by definition, or not by definition, but by virtue, is caused from people who have more narrow and more collapsing airways. Period. That's what causes it. It's the same thing that causes sleep apnea. And this increased velocity of air because of the constriction and the inflammatory process that ensues afterwards leads to upper airway resistance, which leads down the continuum, as you can look at the slide yourself. So snoring is the beginning. I even call it pre-apnea. Do you think that's fair to say, Rich?
Yeah, I do. And it's scary to think that this is a naturally progressive disease. In other words, once you're on that line, you are moving from the left to the right. As we get older, everything starts to sag a little bit and our airways become more compliant. You see above the arrow there, the alcohol and the natural progression. So we know alcohol is a smooth muscle relaxer. So that's certainly going to make our sleep apnea worse. And some of the devices that Keller makes that we're certainly going to support have the ability to be adjusted. And that's very important for your alcoholic patients who need to adjust that a little bit more when they drink too much. Okay, let's keep talking about this. What we ask ourselves,
so you're saying I need an alcohol setting for my device if I have, is that what you're...
When I have this discussion with patients in my practice, I tell them we treat this disease really for two reasons. One is the quality of life issues. We wake up, we're tired, we can't think as well. We want to feel better. But the second reason that we treat this is for the physical ailments that it actually causes. When you look at odds ratios, MI is a myocardial infarction, that's a heart attack. You're 2 times more likely, the same patient, one who has sleep apnea and one who doesn't. The one who has sleep apnea is twice as likely to have a heart attack, 3 times as likely to have congestive heart failure, 4 times as likely to be hypertensive, have high blood pressure. So you look through this whole thing and all of that, and you just can't help but think, my gosh, our primary care physician colleagues are trying to manage all of these diseases.
I think it's also important to note that most of these are directly caused by obstructive sleep apnea in some patients. In other words, I'll give you a good example, GERD. I had a patient not too long ago who had GERD every morning for 20 years, no matter what medications he took, as well as obstructive sleep apnea and being tired and some of the other symptoms. But the first check after making him an oral appliance, he came in, tears in his eyes, hugged me, and thanked me. He said for a whole week, it's how long he'd been wearing the appliance. It's the first time, 7 days in a row, woke up with no acid reflux. Felt great for other reasons, but he was thrilled. So immediate relief of that problem. Other things, hypertension can be directly caused from obstructive sleep apnea. It can be lowered by successfully treating it. many of the other things, including diabetes and lots of the other things on this list. So don't just think that they're associated with those patients. A lot of the times it's directly caused from obstructive sleep apnea. I think it's important to note.